I'm Iahn Gonsenhauser, Chief Quality and Patient Safety Officer at The Ohio State University Wexner Medical Center. Over the past few months, we've seen a nationwide mass vaccination effort come underway. And at this point, over 20 million Americans have received their COVID-19 vaccine. As a frontline healthcare provider, I've received both my first and second dose of the Moderna vaccine, and I've received many questions about what my experience has been like. What I can tell you is that with dose 1, I experienced an efficient and effective operation to get my vaccine administered, and I experienced very few side effects. Dose 2 was a little bit different. The operation to get my vaccine administered was just as efficient, but I had a little bit tougher of an experience than during my first dose. In the day that followed my second dose of vaccine, I experienced fever, chills, sweating, and some lightheadedness. All of these symptoms, while at some points feeling quite uncomfortable, resolved within 24 hours, and by the end of the next day, I felt just like normal. The only difference was, now I felt that extra layer of protection and security in having been fully vaccinated. It doesn't mean I've stopped wearing a mask, nor does it mean I've stopped physically distancing, but it does mean I can see the light at the end of the tunnel. Now that so many people are getting their vaccinations, the big question is, when will life go back to normal? When can I hug my family again? When will I be able to hang out with my friends? The answer to that question is not quite yet. What we're waiting for is enough of the population to receive their vaccinations that we start to see community numbers of infections decrease to manageable levels. The reason for this is that we're still not clear if asymptomatic spread or transmissibility is still an issue after an individual receives their vaccination. Once we have a better sense of that answer, or once enough of the population has been vaccinated, we'll start to see community numbers decrease and the risk of COVID spread diminishing. There's a light at the end of the tunnel. Vaccines work, and we have the most powerful tool yet in our fight against COVID. Get vaccinated when it's your turn. Continue using masks, physical distancing, and engaging in hand hygiene. When necessary, seek testing and utilize quarantine. If we double down on all of these tools, we can move together with care, not fear,